Welcome back to Las Vegas Now. Time to focus on our health as we talk about flu shots, because even though it may not feel like it, winter is around the corner, and with it is also flu season. JC talked with a specialist from Southwest Medical Associates who is sponsoring this segment for more information.
Now, so let's talk about the flu shot. That's why you're here today. Who should be getting the flu shot?
That's a great question. The recommendation, with very rare exceptions, is that everybody 6 months and older should heavily be considering getting the flu shot right now.
So essential workers, should they be stepping in there and getting the flu shot this year?
Definitely. Our essential workers, including healthcare personnel, those who work or even reside in long-term care facilities, anybody who's out there in the public and part of critical infrastructure, as well as those people who may be at increased risk, younger children, elderly patients older than 65, anybody with chronic medical conditions like diabetes or high blood pressure, all of those people are at higher risk and should definitely be getting vaccinated.
So getting the flu shot, will this help ease the pandemic at all?
The flu vaccine is a whole pandemic of its own. It won't have any impact on COVID-19, unfortunately, but it will help protect each of our community members, as well as our healthcare infrastructure, from avoiding potentially scarce resources. We know what that was like, unfortunately, when the pandemic first hit, and anything that we can do to keep ourselves healthy and to really keep those resources there for those patients who need them is definitely a win. So that goes definitely in getting the flu vaccine.
And I'm just looking at this from afar, but it feels like last year's numbers, the flu numbers were much lower because people were still indoors, not doing as much. This year, more people are going out. Are we expecting a bigger flu season this year?
The CDC does foresee that we're going to have just as large of a flu season as we had in the past, even though we've had some quarantine and stay-at-home measures. One of the downfalls of stay-at-home and sheltering in place is that many patients have avoided or not had access to their preventative health care, including immunizations. So as we go into this flu season, mixed with that of the COVID-19 pandemic season, it's so important that we're thinking about protecting ourselves.
When should we start thinking about getting the flu shot?
Now is the perfect time to get it, and I'm glad that you asked. Generally, September or October is the ideal time to be getting your vaccine, knowing that it can take 2 weeks for that vaccine to be active to protect yourself, and making sure you get it before those cases start to come into the community is so important.
And you guys are making it much easier to get the flu shot this year. Tell us about some of the upcoming flu shot events that you have.
So we're very excited on Saturday, September 18th, to be having our first drive-through flu shot clinic. That'll be at our Tenaya Healthcare Center at 2704 North Tenaya Way from 8 a.m. to noon. And we're also going to have a second drive-through flu shot clinic on Saturday, September 25th at our Eastern Healthcare Center on 4475 Southeastern, also from 8 a.m. to noon. Of note, both of those locations will also be offering the COVID vaccine, though that will be indoors, not drive-through. And the first 100 cars at each event will receive a free Vegas Golden Knights gift, and Chance will be dropping by too.
We want to thank Southwest Medical Associates for sponsoring this segment. If you need their help, they do have locations across Southern Nevada. Give them a call for more information at 702-877-5199 or visit them online at smalv.com. We'll be right back.